Okay, ma'am. Thank you. In this session, my first presenter is the Dr. Indu Bhatt, she was a DART research fellow from Germany, and presently they are the assistant professor in the IMS Institute, Ghaziabad. Ma'am, please, we like to invite you to start your session, please. Thank you, ma'am.
Thank you, Dr. Anu. Yeah, am I audible?
Yes, your voice is very clear.
My voice is clear. Okay, thank you. Thank you, Dr. Anu, for the invitation. First of all, I would like to congratulate RRPG College for conducting such a nice webinar on the current situation. Then very, very big thanks to my friend, Dr. Shekhar Shukla, for inviting me to this webinar. So I would be presenting, Dr. Anu, can you please, I have been disabled to share my screen. Can you please enable me to do this? Dr. Anu? Dr. Anup, I'm unable to share my screen. Can you please enable me to share my screen?
Share a screen.
Yeah, thank you. Thank you so much. Yeah. So a very good afternoon to everyone who is present here. I will be presenting my views on a comprehension of socio-economic impacts of COVID-19. At the outset, first of all, I would like to introduce myself. I'm Dr. Indu Bhatt. I'm assistant professor in the Department of Biotechnology at IMSEC Engineering College, Ghaziabad. So I think, since morning, we are actually having a detailed insight into the COVID-19. So I don't think that it requires any such introduction, but still, as we all know, that novel coronavirus was first identified in China in Hubei province in the end of 2019. And since then, it has become a pandemic in the entire world. And it is really an alarming situation, as you can see here that this picture shows the current number of cases. I took this picture today from the Worldometer, and as you can see that more than 5 million cases have been recorded since, and there have been 3 lakh deaths, more than 3 lakh deaths. Now, if you see here on the graph of total number of cases, you can see here that since March 16, there has been a substantial increase, an exponential raise in the number of cases, as well as since March 25th, you can see that the number of cases of the deaths whole across the world have also increased significantly. So now if you see here, yeah, just a moment. Okay, so as I just told you that COVID-19 pandemic has resulted in over 5.5 million confirmed cases and over 3 lakhs death globally. So this is actually a very, very scary situation, as the number of cases are alarming, are raising every day, and the number of deaths are also increasing. So the biggest preventive measure that has been taken by the government all across the countries is the lockdown situation, in which the people are observing social distancing, self-isolation, and travel restriction. So definitely, the major sectors like, all the business, the travel, the schools, everything is shut down, and we all are. I will be presenting my views on a comprehension of socio-economic impacts of COVID-19. At the outset, first of all, I would like to introduce myself. I'm Dr. Indu Bhatt. I'm assistant professor in the Department of Biotechnology at IMS Engineering College, Ghaziabad. So I think, since morning we are actually having a detailed insight into the COVID-19. So I don't think that it requires any such introduction. But still, as we all know, that novel coronavirus was first identified in China in Hubei province in the end of 2019, and since then it has become a pandemic in the entire world. And it is really an alarming situation, as you can see here that this picture shows the current number of cases. I took this picture today from the Worldometer, and as you can see that more than 5 million cases have been recorded since, and there have been 3 lakh deaths, more than 3 lakh deaths. Now if you see here on the graph of total number of cases, you can see here that since March 16, there has been a substantial increase, an exponential raise in the number of cases, as well as since March 25th, you can see that the number of cases of the deaths whole across the world have also increased significantly. So now if you see here, yeah, just a moment. Okay, so as I just told you that COVID-19 pandemic has resulted in over 5.5 million confirmed cases and over 3 lakhs death globally. So this is actually a very, very scary situation, as the number of cases are alarming, are raising every day, and the number of deaths are also increasing. So the biggest preventive measure that has been taken by the government all across the countries is the lockdown situation, in which the people are observing social distancing, self-isolation, and travel restriction. So definitely, the major sectors like, all the business, the travel, the schools, everything is shut down, and we all are present inside our house. It's been almost 2 months now, and everything has come to a halt. So the social distancing measures, what exactly they have told us. So the first of all is that, it has advised the whole population to self-isolate at home. And in that condition, let us assume that if there is a person who is having some symptoms, the person who has had a travel history, or who has come in contact with a person who has shown symptoms of coronavirus, so that person has been advised to self-isolate, that is called as quarantine, for at least 14 days in the house. Then it also bans all these social gatherings, the gatherings like, weddings, like parties, all the prayers meet, etc. So all these social gatherings have been banned since then. The flights, the public transport, they've also come to a halt. Then the non-essential workplaces, that is beyond the health and social care sector, utilities, and the food chain, have also been closed, so that the people are not going out for unnecessary things. Then, as I just told you, that the school, colleges, as well as the universities have also come to a closure. Then there is a limiting contact for special population, for example, in care homes, in prisons, etc. So now I would like to talk about what effect these social distancing measures have put on the general public. Yes, of course, we all know that this has somewhere reduce the number of cases, and this is the first prior most strategy for us to fight the COVID-19 outbreak. But then there are other measures also, and some negative impacts also, that are ongoing because of these social distancing measures. So as you can see, that the first thing is that, when you have self-isolated at home in case of symptoms, there are a number of social stigmatization that have been aroused. So for example, the person who has been in a lockdown situation inside the homes, they are facing very, very negative psychological effects. They are, traumatized. They are thinking that what will happen next? Is the world going to come to an end? Are the effects going to be really long lasting? What is exactly the time that we are going to fight against it? Then the second important thing is that there is a stigmatization and discrimination. I don't know how many of you have heard this news, that the people who belong to northeastern countries, the northeastern regions, like Manipur at all, the people who actually resemble Chinese people, they are being named as corona. I mean, that is really very, very disgusting, that people are being discriminated on the basis of this. So it is a very big social stigma. Apart from that, uh, you know, uh, one side we are really appreciating doctors, but there is a very negative side to it also, that the doctors and the health workers are also facing discrimination and non-acceptance from the society. There was a news that the doctors are facing challenges, as the people who are actually living on rented apartments, the landlords are asking them to evacuate because they think that they can actually transfer the disease to them. So this is really a very scary situation, and because the people are thinking that they can be ostracized, and because of this the people are hiding their travel history. They're hiding that if they're having some temperature issues, they're having cold, runny nose, if they're having sore throat, so the actual condition is being hidden. The people are really afraid of seeking the proper treatment because of this discrimination by the society. And because of that, there is a lot of problem in the actual reportings of the cases, and definitely there is a fear amongst the population out there. Now, the second thing that has come up is the increased incidences of domestic violence. We all know that the domestic violence, not only in India, but whole across the world, is really very much there. And it is there for women, for child, that they actually are, facing a lot of abuse. And these incidences have actually increased when we are in a lockdown situation. And the reason is that the person who is somewhere responsible for the abusive behavior is staying with the person all the time. There is this mental trauma, there is a stress situation, the panic is there, and definitely it is actually mounting stress to the partner. And that is the reason why the domestic violence incidents have increased tremendously in this lockdown period. I have this data that shows that not only in India, of course, yes, we think that India is one such country wherein domestic violence is very evident when you talk about women, you talk about girls and children, but this is actually not true. Whole across the world, I must say that the domestic violence cases have increased. So as you can see here in this picture, that in France, since the lockdown has been enforced since March 17th, there have been 30% such increased cases. Not only in France, but in Singapore, there have been 33% increased cases of domestic violence in comparison to what was reported before. Similarly, when you talk about Argentina, there have been 25% rise in the domestic violence cases. And the increased cases of domestic violence and demand for emergency shelter have also been reported in very advanced countries where we cannot even think about the domestic violence actually happens, like countries like Canada, Germany, Spain, UK, as well as US. If I talk about the Indian scenario, definitely in Indian scenario also the number of domestic violence cases have increased tremendously. And as since the lockdown has been enforced, there have been 700 reported cases in Punjab, and whole across the nation, the number of cases have increased tremendously. And it is expected that nearly 15 million, yes, I'm right, 15 million expected rise in the domestic violence cases is it can be there if the lockdown is increased further, so which is actually a very alarming situation. And the person who is subjected to this domestic violence is actually not having any rescue measure, because the person cannot go out for help, the person cannot seek help from anyone, because there is a fear that if the person will step out, there is a fear of getting coronavirus. So definitely yes, there is no escape, and we don't know what exactly will happen of these incidences. So that is, yes, of course, a very negative impact beyond the health measure. Then the other thing that the social distancing has enforced onto us is the closure of school, colleges, and universities. And we all know, we all are facing this because we are researchers, we are academicians, we all are, somewhere faculties and researchers. So definitely we all know that, there is the closure of schools, colleges, and universities. So this picture has been taken by UNESCO. It's a very recent picture. This a very recent picture taken on 20th May. And you can see here that there are three colors that have been shown. The purple color shows that the country-wide schools, colleges, and universities have been closed, whereas the pink color shows that there is a localized closure of the schools and universities. That means in some areas of these countries, the schools and the universities are closed, whereas the blue color, which is very, you can see very small and insignificant in number, there is the schools are open. And if you actually see the bigger picture, you can see that the entire world is in lockdown, closure of schools and colleges, and you can see the figure here that many billion of learners are going to be affected by this. And what effect? We think that we are able to have such webinars, we are able to take classes for the students, we are able to share our knowledge through notes, we have these Zoom apps, we have WebEx with us, through which we have Google Meets, for example, multiple seminars are being conducted, in which we are getting to know that how we can share the knowledge with the student. But there is a downside to the story, and believe me, we are not able to share a knowledge. Even if I say that even 50% of knowledge that we actually can share in the classroom session, I'm not exaggerating that, because the when you talk about the closure of the school, the universities, there are two measures to that. The first thing is that what is the effect on the parents who are homeschooling, and what is the effect on the children who are taking this online education. So it is actually having a negative impact on both these a lot of people. Let me talk first about the stress that is there on the families, the parents who are homeschooling their children. So the first thing is that as even for example, today also we are working from home, and we all have children, right? Some of us have very small children, like I have a very small daughter, I have a 2-year-old daughter, and many of you must be having a kid who is 10-year-old, many of you must be having a kid who is going to university. So definitely we have all ranges of all age group of children with us, and it is really very difficult working from home. One, we say that yes, of course, the capacity when you're working from home has increased, but what about the connect we are having with our children? Are we really having that time with our family, or we are stuck with our jobs? So definitely there is a stress to the parents when they're trying to work from home, when they're trying to give time to their children, the children demanding, when they have to work on their problems. So it is very, very much difficult, because there is housework, then there is their office work, then there is the homework that has been given from the school. So it is, yes, of course, very, very difficult. And you won't find me wrong if I'll say that the burden is actually mostly on the women, because women are primarily working in the home also, the household work, the household daily chores they are doing, they're taking care of the kids, they're taking care of their office work also. So definitely, yes, there is a huge stress, mental as well as physical, when you talk about the women. Then yes, of course, this is, and definitely this is somewhere leading to a lot of fights in the home. And definitely this is also contributing to the domestic violence, because there is no equal division of labor, and the stress is increasing tremendously. Now let us talk about what is happening to the students. Yes, of course, we say that we have all the avenues, we have worked a lot, and we are providing them quality education through online learning portals. But as we teach in classroom, we all know that that kind of connection we can never have through an online course. When we are dealing with a class of, let us say, a batch size of 60 or 50 or even 40 students, that one-on-one interaction is actually not possible. That happens in the classroom. So definitely, in each class we have a substantial range of the students. We have those students who are really very good in studies, who are intelligent, then we have students who are mediocres, and then we have students with us who actually require a lot of time. And it is this bunch of students who require a lot of time from the teachers, a lot of attention from the teachers, and they get that time in the college, in the university, in the school. The time has significantly reduced, and this is these students who are going to see the most loss in their academic performance later on when the lockdown is open. Then apart from that, there is another factor. And if I talk about a country like India, we have a segregation of the rural and the urban sector. And definitely, when you're talking about online mode of education, we are talking about the connectivity of the internet. And I hope all of you will agree that the connectivity of internet is not available that much in the rural areas, and because of which the student, the learners, the people who are who are going to school, colleges as well as university, and they stay in the rural areas, they are facing a lot of challenges in connecting to these online classes and gaining knowledge from them. So definitely, there is going to be a severe loss and a gap and inequality in the educational outcomes once the country comes back to its normal routine. Apart from that, we all know that there are benefit of free school meal to the low income group. Yes, of course, you can say at this point of time that the people, they are actually getting meals by the government, but still it is very much difficult going every day out, standing in the queue to get a daily meal, and that to the same kind of meal. It is actually very, very difficult to have that meal. So definitely, yes, of course, there's a loss of benefit of free school meals for the low income group as well. So yes, these are the downsides when we say that the school, universities, as well as the colleges have come to a total closure in the entire world. Then there is another thing which is really very disturbing to see that there is a wage loss, there is destitution and homelessness of these migrant workers. We see every day that these migrant workers are walking without any resources. They're ready to walk hundreds of miles to reach to their hometown, and many of these migrant workers are not getting any place to reside. They're not getting any food. Then they're walking out with children. Recently there was a news of pregnant females walking with one more kid in their hand, pregnant females giving birth uh, by the roadside. So this situation actually is very disturbing, and it gives a very big time, I'll say, a social mental trauma, that what will happen to these people if you just become concerned. Definitely government has taken its measure, but the situation of these migrant workers, the laborers, is really very pathetic and very disturbing to see the news channel showing the story. So this actually is, I will say, I don't know about others, but definitely if you talk about my viewpoint, this situation is something that puts me into literally a kind of depression, that what will happen to these migrant workers. They also, need some rescue. Then I will come to the second aspect. Definitely there are other aspects also, but now I will cover few aspects on the global economy, the downside of the lockdown, that the major effect is there on the global economy. And I would like to explain the effect on the global economy by the help of this graph. As you can see here that when the lockdown was enforced, the main reason to enforce the lockdown was to flatten the curve. So by now we all understand what does flattening of curve means. It means that the number of cases, definitely we don't have any vaccine, we just can somewhere reduce the number of cases that are rising every day, and we can just flatten the curve. So yes, of course, we have been somewhere we have achieved that also. We have flattened the curve also by the medical containment measures, but there is a downside. And as you can see that if you just see the other side of the story, yes, of course, we are flattening the curve, but we are steepening the recession curve. Now if you see here on this graph, here, this is showing the normal recession curves when there is no containment policies. You can see that the curve is actually sharp, but not that much sharp if you just compare it with this curve. This curve is really steep. So that means that when you are talking about the containment measures, definitely we are going to see the flattening of the curve when you talk about the new cases of coronavirus. But if you talk about recession, the severity of recession is increasing every passing day, and the containment measures flatten the infection curve, but it steepen the recession curve. And that is something which is most alarming situation, and we need to address it very soon. Otherwise the world economy will crash soon, and it will take decades to recover from it. So now I will go with some of the facts that you can see here, that this data was published by Statista, and it says that COVID-19 could push 500 million people into poverty. Now 500 million people is a very significant number, and the countries that are going to be most affected will be the countries in the East Asia and Pacific, and following this will be the South Asia. So you can see here that 1 billion people are going to go into poverty because of the recession that is going to be there due to the COVID-19. Then another similar study shows the most impacted and the somewhat less impacted industries that are hit by the COVID-19, and the top most of these, in which there is a 5.5 million impacted people, is full service restaurants. Then there are temporary help services, definitely accommodation. If you talk about travel, tourism, accommodation, entertainment industry has also seen a major loss. Then we all know about air transportation. We all know that all the flights have been suspended. The travel arrangements have been suspended. We have no sightseeing. Everything has come to a standstill, and these industries are seriously impacted, and that is the reason why many people will lose their job, and that will lead to a very big recession in the coming future. So you can see here that as I was just telling you about the impact on these jobs and industries, you can see that this is again a very disturbing figure that shows that coronavirus outbreak will put 37 million US jobs at risk. So when I'm saying 37 million US jobs, it is only in US, 37 million, and it is a huge figure. So just think about the global thing. In the global scenario, when we say that US has the biggest economy, and it is the biggest the country, it is the ruler, I'll say, and therein there are going to be 37 million jobs. They are going to be risk, and maybe 37 million people are going to lose their job, and they are going to be there in the recession. Definitely it is going to have other social impacts. It will we saw a major recession in 2009, and in which people committed mass suicides also. There was losses in business, and things were really haywire, and we definitely don't want to see that kind of a thing coming very soon that is going to hit us. Then this is another sector that has been shown to, that will lose over $500 billion in 2020, and that is the travel industry. So this figure shows only the accounts of the US system, and we can see $500 billion is not a small figure. It is a huge figure if you talk about the loss in the finances. So definitely, yes, of course, the travel industry is going to be hit a lot. Then amongst the, in this travel industry, there is another industry, that is the airline industry, and you can see the data of all across the world here. You can see that Asia Pacific region is going to be hit the most, followed by Europe, then North America, and then Middle East. And as you can see here, that the coronavirus could cost airline industry $113 billion. So that is a loss that can be there to the airline industry, and is a huge loss. This graph depicts the effect of coronavirus on the global economic growth. The dark blue color here shows the forecast before the COVID-19 outbreak, whereas this light blue color shows the revised forecast. When the COVID-19 was declared as the pandemic. COVID-19 was declared as the pandemic, and you can see that everywhere, whole across the world, there is a downfall in the forecast of the global economic growth. So it has been shown that be it China, Japan, Korea, the Eurozone, be it Italy, be it UK, US, Russia, whatever part of the world you name, everywhere there's going to be a major slump in the economy. Now, if I talk about Indian context, the Indian figures of the loss of finance, the global, the impact on the Indian economy is also very disturbing. So if you see here, this data is showing the loss of these particular industries in crore of rupees. So you can see 1,62,099 crore rupees will be lost in the financial, real estate, and professional services. So that is a huge loss. And similarly, if you talk about trade, hotels, transport, communication, and services related to broadcasting, there is a loss expected in the year 2020 of 1,61,055 crore of rupees. Similarly, if you see that there is going to be a loss in manufacturing, in electricity, gas, water supply, other utility services, there is going to be a tremendous loss. And we have to somehow combat and come up with measures by which definitely the recession is going to be there, and we just cannot stop it. But definitely, yes, there has to be a plan by which we can say that yes, the slum that is the unforeseen, or now I must not say unforeseen, we can very well see what is coming to us, and we are not able to control it anyhow. We have to look forward to the measures by which we can somewhere contain even this recession. So with this, I would like to conclude my talk. So yes, of course, as it first of all, I would like to conclude. So what exactly has to be done on the social background? The first of all, the general public needs to be educated about COVID-19, because many people still think that it is not evitable to wear mask and there is nothing. It is coronavirus is just an inflated thing. They are not ready to believe that yes, it is there, or maybe it can infect them. Then the second point is that positivity should be spread. For example, when I talk about the incidents that is happening to the doctors, that the people are not treating doctors very nicely, this is very disturbing, and we need to spread positivity. And not only in terms of the doctors, but yes, of course, when people are staying inside the house, there is a psychological impact, and many people are undergoing depression. They are not able to talk to their counselors, and that is the reason why the yes, of course, we have very, very disturbing figures, but then definitely there has to be positivity around to keep our, hopes soaring high. Then the third important thing that talked about was the educational sector. So definitely, yes, we need to strengthen our educational system. And like Western countries, they're already doing good, but in developing countries like India, we definitely need to strengthen our education infrastructure. Then talking about the domestic violence increase cases, there has to be the people who are more vulnerable, like the women and the children, for this domestic abuse, that has to be taken care of. There have to be the helpline that should be really nicely working. There should be email communication, there should be phone numbers, and maybe I don't know, but maybe some camps should be set up near such localities where we know that like in areas like slums, where we know that these domestic violence cases are abundant. So there should be some setup there, so that we can save these ladies and the children from the domestic violence. And coming on the economy, definitely yes, there is a fear of the financial collapse, and we need to have very strict relief measures that should be immediate. They should be immediately implemented. A wise decision should be taken on that. I think that the medium and longer term planning should be that the small and medium scale enterprises should be given a boost up. The industries which are already running, they should also be given some aids, and we have to just allow our economy to run smoothly. Because if the economy collapses, nothing is, I'll say that if the economy collapses, coronavirus will actually be a comparatively lesser threat. So that is what my thought is about that. And with this, I would like to end my talk. And in the end, I would like to say thank you for being such a nice audience. If you have any question, I'm there to answer you. And I would like to say stay safe